like an X-ray table. The anesthetist is the doctor who will start your intravenous and give medication to keep you relaxed and comfortable. Your heart rate and blood pressure are monitored throughout the treatment. A mask may be placed on your face to provide oxygen. If you require a stent, it will be inserted at this time. You will then be carefully positioned with padding placed around you. A part of the table will be removed, the lights are dimmed, and an X-ray scanner moves about you to target the stone. When the procedure starts, you will hear a repeated banging noise and may feel a continual tapping sensation against your back. Remember not to move. If you feel uncomfortable, let the anesthetist know by raising your hand, and more medication can be given. The nurses, surgeon, X-ray technician, and anesthetist are nearby. The procedure takes about 45 minutes. Once this is over, you will return to the daycare unit. The nurse will take your blood pressure, temperature, and check the treatment site for any redness or bruising. This redness is normal and should clear in about 2 days. Your intravenous will be removed once you are tolerating fluids. Even after you leave here, you may want only to sleep. Because of this, it is important not to drive a car for at least 24 hours after your treatment, even though you may feel more like yourself in the morning. Your judgment may be impaired due to the medications you have received. You must not drive for 24 hours. Since your stay is short, you must be aware of how to best care for yourself after leaving the hospital, and what to do if you have any major problems. We have provided you with a copy of discharge instructions, which we will now review. Shock wave lithotripsy will crush stones into tiny sand-like pieces which will pass as fluids wash them through the urinary tract. For this reason, we recommend 8 to 10 glasses of fluid. Water is best, keeping your coffee and tea intake to a minimum. You may have blood in your urine for a few days after your treatment. If this lasts longer than 1 week, or if you see large blood clots in your urine, call your urologist. Remember, if you have a stent in, you can expect to see blood in your urine at any time, while that stent remains in place. You should strain your urine in order to collect stone fragments. Strain for 2 weeks or until you see your urologist. He can further direct you. Once you return home, you can do all of your usual activities. Short walks may help move stone pieces along the urinary tract. We will give you a prescription for pain medication before you leave. You may have some discomfort in your side because of the shock waves. Many patients describe this as a toothache type of feeling. This generally lasts 1 to 3 days. Pain may also be caused by stone fragments moving down the urinary tract. Soaking in a warm bath may help ease any discomfort. You may also receive a prescription for an antibiotic. This is either to treat or prevent an infection. You should get started on this tonight and finish all of this medication as directed. This is usually needed for 7 to 10 days. Not all urologists routinely order this. You can get back on any regular medication that you may have been taking immediately after this treatment. Call your urologist or go to the nearest emergency department if 1. You are hot, then cold, with a temperature of 38.5 degrees Celsius or 101 degrees Fahrenheit. 2. The pain is not controlled by the medication you are taking. 3. You are unable to keep fluids down. Or 4. You are unable to urinate. It is very important for you to see your urologist in 1 week, at which time he can best determine the results of this treatment. About 15% of our patients have required a second lithotripsy treatment on the same stone. This could be because the stone is large, is an especially hard stone, or it may be in a difficult location. Your referring urologist will generally make this decision with you and can make similar arrangements for you to return here if necessary. In summary, you should 1. Follow up with your urologist in 1 week. 2. Drink 8 to 10 glasses of water per day. And 3. Watch for fever and chills or severe pain and report to your urologist or emergency department.